Assessment is really great because it encompasses more than just massage, right? So you're going to be taking on movement. You're going to learn kinesiology in the program. So you're going to understand how the body is supposed to move. Now, with assessment, to really be good at it, we actually want our students to understand other modalities that aren't inside our scope. So what I mean by that is, as a massage therapist, I am going to be trained and understand certain techniques that I am allowed and competent in providing, performing on the body. What is crucial for me to really be good at what I do is to understand other modalities and techniques. So what that means is like understanding what physical therapy does for the body. And a lot of us have heard of physical therapy, but we may not really understand like its importance or the role that it plays in pain, pain management, posture correction, the different ailments and pathologies that clients bring into the session. And so, and that's just one thing. There's all kinds of other modalities that we want to introduce our therapists to that they don't need to practice, but they do need to understand how they work because they're complementary to the work that we do. And to best serve our clients as a therapist, if we can properly assess what's going on, and this is not diagnosed, we're not doctors, we are not medical professionals, we don't diagnose, but we can assess and make recommendations. So through our assessment practices, we teach them to feel and to palpate, and sometimes, as you get farther in the program and farther in your career and your sensitivity increases, you can feel where maybe a muscle is atrophied and it's weaker, and where another muscle is overcompensating or really tight and tense. And if you can assess that, then you know that if you just massage where the tension is, that they're only going to get temporary relief. And so what happens is it's not a service to the client, nor does it bode well for their understanding of your skill level, right? So lots of clients will go to a therapist who will massage the tight area, and then it tightens back up because it's a compensation pattern or an imbalance. And so that client tends to go, oh, well, I guess massage just doesn't work and it's not helping. And oftentimes it's that they do need massage and they need some strength training or some physical therapy, or we're doing massage to tension, but their skeletal alignment is off. And so we don't do skeletal adjustments as massage therapists. But the tension from the muscles can cause disalignment, but while a massage therapist can create relief to that tension, they can't put that alignment back into place, like in that spinal structure. So it's really important in the assessment process for our students to start grasping these concepts and getting really curious about other healing modalities so that they can make the best recommendation for their client. Because then what happens is when the client starts getting a massage from them, and then the recommendation is, hey, like I can feel that these ribs are out of place and they're not knots. So this isn't something that I can massage out of your back. And I recommend that you go see a chiropractor and see what they say. And when this happens and the client goes and sees that chiropractor or that physical therapist and backs you up, right? Like I'm like, hey, I feel like there's maybe a couple ribs out of place. And then they come back from the chiropractor and they're like, oh, I had like 3 of them. And don't judge out of place. I just mean they're not quite in alignment and they need an adjustment depending on those terms that you might have connected to it. Then the client goes, wow, you really know what you're doing. I'm going to trust you even more with my well-being. So this is an important part of assessment, and we have it in our program so that our students are successful so that they can really help their clients.